And all right, macro perspective peeps. How we all doing today? Hopefully you already know what you clicked into, and we have yet another interview with an esteemed guest. And Dr. Yazdani, thank you for joining us today. I'll have you kind of give us an elevator pitch as to who you are, what you do, where you're at in the world, etc.
All right, Macro Podcast. Thank you for having me on. My name is Dr. Shayan Yazdani. I'm a chiropractor based out of Coeur d'Alene, Idaho. Recently relocated here from Orange County. Uh, the style of practice I primarily practice is diversified, and I'm into all aspects of health, fitness, bio, psycho, social, nutrition, whatever you can do to make your life better, improve your quality of life, your mental health, your physical well-being, anything. I'm about it.
Awesome. Look at that. 30 seconds. Are you sure you weren't in this meeting I was at earlier today? So, you know, what makes chiropractic? Like what makes it special? Like what made you fall into that particular vein? I mean, you said that in your dossier here that you come from a family of doctors, but I'm assuming that might be more traditional doctor, or what kind of doctors are they?
Yeah, so both my parents are dentists. I've got an anesthesiologist in the family. My brother is in med school right now. So I would primarily put them under the realm of Western medicine. And chiropractic is historically fallen more under Eastern medicine, but more recently it's being taught more Western style. So it's almost a hybrid in between. And I think there's a beauty in that because medicine is starting to go the direction where people are looking for evidence-based, natural healthcare alternatives rather than just going and getting a pill, prescribed to them. I mean, I can't tell you how many times a patient will come up and they've got a bag full of prescription pills and they just like, they tell me I don't want to take this, and I'm looking for another way around. So,
Yeah.
and I guess to answer your other question, was it how did I get into chiropractic?
Yeah. What drew you to that? I mean, obviously you said you're like kind of like the Eastern approach a bit more than maybe Western stuff, but like why chiropractic specifically?
Yeah, so I was a biology major in college, and knowing, being from a family of doctors, I knew that I was going to probably pursue a field uh, in healthcare. And so I was always into fitness and nutrition, just from going to the gym, doing bulks and cuts. And so uh, the tough question became, what aspect of medicine do I want to practice? And so what I started doing was getting out and shadowing a lot of different types of doctors. So I already had experience with dentists, orthodontists. I went to a veterinarian's office, and I realized I don't like animals as much as I thought. Um, and optometrist, and so on and so forth. And I was just starting to get so stressed out because you're in college, you're going through the curriculum, but you when you don't have a set direction or goal that you're going towards, you feel like you're wandering at sea.
Mhm.
And so I started getting so stressed out that I had this terrible tightness in my neck and traps. And so I needed to get treatment for it. And so I went on Groupon. I found a chiropractor and 1 hour massage. And I went there, and within one visit, the guy fixed me up pretty good. And I thought, well, I never considered this profession. And so I looked deeper into it. And turns out I had a couple family friends. I didn't know them very well, but they were chiropractors. And I spoke with them, and they said, Shine, if you're interested in this field, it would be perfect for you. You're tall, you're athletic, you're approachable, you're able to have a conversation with people. These are the traits that make a good doctor and a good chiropractor. So I looked up chiropractic school near me, and there was one in Whittier, which was 20 minutes from where I grew up. And I applied, they accepted me, and from there, that's where it started.
That's
Which
amazing.
school is that near Whittier?
Southern California University of Health Science.
Okay.
Yeah, their chiropractic program is more commonly known as LACC, Los Angeles
Yeah.
Chiropractic College.
Yeah, yeah, yeah.
Got it. Okay.
Yeah.
That's amazing. That's awesome. It's a great story. I think sometimes you don't know what's on the horizon until like a pain comes, and then you become an expert in the pain that you're dealing with. Like in your specific case, you're like, I was dealing with the neck issue, and what did he kind of do? Like I know that certain chiropractics, they're the mainstay of it is like adjustments, right?
Yep.
Did he do any other like modalities, like soft tissue manipulations or like soft tissue work, and then just the manipulations, or was it just the like the basics of chiropractic?
So he did an adjustment, but he also did some, it's called active release technique or ART,
Yeah,
and just helped loosen up those muscles in my neck. And then there was a deep tissue massage that was associated with it.
yeah,
And man, that did the trick. So,
yeah,
and with most musculoskeletal injuries, there's two, sometimes three components. There's a bony or joint component. There's a soft tissue component, whether it's a muscle, ligament, tendon,
yeah,
and then less commonly a nerve component to that, where you may have numbness, tingling, sharpshooting into the arms and fingers.
yeah,
So if you can address those three things, you're going to cover most problems.
yeah. That
Mm.
makes sense. And so you go through school. How is that process when you've been hearing from your family like a dentist and anesthesiologist, like what when you went through school, like did you notice, I don't know if you can compare it, but when you asked your parents or family members, like what was the difference? Is it just like a curriculum difference, or like a is it more hands-on? Did you feel like you were already hands-on in the field? Was it mostly textbooks, or how did that go for you when you're in school?
Yeah, so it's definitely a hybrid of both. The curriculum in school is very similar to a med school curriculum. And so you're learning a lot about anatomy, physiology, um, and then you're also having classes where you're hands-on working with classmates, getting the skills that way, feeling difference in people's muscle tones, how their joints are moving, do they have spring to them, do they feel arthritic. So it's a pretty comparable curriculum. And I've spoke with my brother who's about to graduate med school, and he's taken a lot of the same classes. So I think you need to do that to have the title and be able to be an accredited school and
Yeah,
graduate as a doctor.
yeah, a bit of that hybrid, hands-on, all that. No, I love that.
Yeah.
When it comes to where you're at now, like, are you like inpatient? Like, do you have your own area? Do you have your own like practice that you're running now? Are you part of a practice? What's going on there?
Yeah, so I moved recently, so I'm setting up my own practice here. But prior to that, I was part of a group called Inspire Chiropractic Health and Wellness.
Oh, nice.
And our practice was chiropractic, but also had um, massage, physical therapy, cold plunge, acupuncture, um, red light. So,
Oh, had the
all
whole gambit. Had the whole gambit. I was about to ask. Yes, like when it came to like your therapy modalities, like when you work with someone, you could give us a case or something like that. It could be extreme. It could be whatever. Yeah, how does it look like for you? You're mostly using hands. I know that before we were speaking, you said, hey, you don't try to utilize other um, tools, just making sure that you're utilizing your hands. Um, how does that usually kind of go? I mean, I've had some chiropractic adjustments. My favorite is the one where my buddy pulls my head and separates my head from my body. I don't know why I like that one a lot. I'm like a crack addict or something like that. But what is it like when working with you? How's that process go? And yeah, do you use any other modalities like if you were in that Inspire spot?
sure. I, when someone comes to me, the only thing that I do for them is chiropractic, but I do often refer out if someone is having an issue that's maybe not being resolved with just the adjustment.
Yeah,
Um, and so I tell people this a lot. chiropractic, the relief that you get is in large part a short-term relief. And if you want to capitalize and keep that relief long term, you need to do some aspect of strengthening, whether that's with a physical therapist. So, like, let's say you have a frozen shoulder and it only goes to 90 degrees here, and
Mhm.
I get you to here. If your muscles cannot support that shoulder through this whole range of motion, you're going to come back to just being stuck here because the muscles just cannot support this movement that you want to do with it.
Mm.
So, you know, in chiropractic school, they teach you all these things: adjustment, um, soft MRT, ART, um, ultrasound, like modalities. But when you get out into practice, you kind of have to, you want to do everything possible for a patient, but then you also have to be business minded and understand, okay, what are my time constraints? What is the business model and way that I'm going to be able to practice within?
Yeah.
So I always like to go narrow and deep and just focus on one thing, offer that. And if someone needs to have other things as well, I'm always going to have a network of people I can refer them to and collaborate.
Yeah. Yeah. Oh, Marcos, you're muted, brother.
Oh, so sounds like the collaborative venture was like part of the previous thing, so it was easy to kind of refer within, right? And then be
Yep.
able to kind of be like, okay, cool, like due to X frozen shoulder, go see my boy over here. He's going to help you with strengthening, your rotator cuff or whatever it is. It's like helping with the actual mobility of the joint afterwards. In terms of like, I mean, I know there's not quote unquote a more common problem that you see necessarily, but like maybe you do, maybe because of like the desk bound nature of everybody. Like, what is like a typical thing that you do, in that treatment sense? And then also like, are there things of like self adjustments? Because I've seen a lot of videos over recent years with like, online chiropractic people kind of saying, here's some ways to kind of self adjust.
Sure. Yeah. So to answer the first question, the most common things that I see, it's definitely neck and lower back pain. And generally, when you think of lower back pain, it's more from, someone bent over and they lift something or they're tying their shoe. But these days, neck and upper back pain has actually become the number one complaint that I see, and it's also non mechanism of injury based neck pain, meaning like they didn't hit their head or twist their neck or something. It's just from chronic poor postures. And most of the people who come in and see me are people who work desk jobs. And naturally, it just brings everything forward, brings your head forward, and just puts strain on those muscles on the back of your neck. And then compound that with stress as well. And that's just the most common thing that I see.
Yeah,
Yeah.
that forward lean, that desk tilt, or what's the anatomical
Tech neck.
reference
Tech
term?
neck.
Technical. Well, yeah, but there's like an actual name. It's in one of the papers. I stare at it daily. It has like a positioning name, but whatever.
Maybe
Um,
upper cross syndrome.
or there it is. Yeah,
Yeah.
that one too. I mean, yeah, I have. It's funny because for years when I was competing in CrossFit, like I would religiously see my chiropractor. Granted, he doesn't live on this side of town anymore, like on my side of town anymore, so it's a little inconvenient, and like no one's quite as good as him in that like domain. So I just am like, meh, I'll just go see my trading partner who's a physical therapist. He's like, I can crack you too. I was like, well, can you though? Like, he's like, yeah, no, it's part of our school. I was like, oh, okay, well, I learned something. So he's done a couple adjustments on me, got some of those like tight upper, like thoracic issues that I typically deal with and whatnot. But I definitely like believe like you said, that quote unquote that short-term relief or that like ability to kind of open something up that felt like kind of guarded and locked, and then having to be like, oh, like, okay, so you're helping me here, but what do I need to go home and do? And I feel like for a lot of people, homework from any provider, like no one really generally goes and does it, and you probably
No,
would agree.
we assume they never did it. So Yeah.
But I tried to stay on. He's like, I need you to like go and do step ups, and like I'm like, all right, cool. Well, I'll go do step ups to get my glutes to fire better, or whatever that is, dealing with my, my lumbar issue. And he was always very adamant of like giving me like 1 or 2 movements per time, which I like thank him for to this day, because I would definitely try to incorporate that, whether it was like in the warm ups that I would do or in the actual like strengthening phase, to like again try not to deal with that dang issue again. But I
Sure.
mean, still seeing him once a week though, like I'm like, oh, my body definitely feels just like a sense of relief.
Yeah. And what was the second part to that question? Remind me.
uh, in terms of that was a good question. I'll probably play it back and I don't remember, but I'm having a gaff moment.
I forgot it too.
Yeah.
It's okay.
Well, but I think at the end of the day too, like so I mean, obviously with like your practice that you're starting now versus the old one that you worked with, right? And you mentioned before we got on this kind of saying, hey, like really big into like my hands being the ones to use and do all the therapy here, right? Um, with your like adjustment, and then like is it like you heavily relying on that ART and those kind of like fascial releases in addition to the adjustment, or is it really like are you kind of more so keen on seeing how like a particular adjustment will be able to fix somebody? Because I know that there's, I mean, varying degrees of people with like their skill set with like the adjustments. And even my buddy that's in South Africa mentioned like some of the shit that professors would do. He'd be like, yeah, I see that, but like I wouldn't have thought about like whatever it is, like their way of triaging and like going after like a foot or an ankle or something like that to fix something in a hip or a knee, like just the whole all the chained components of that. So like is that what you're kind of at, is like you were trying to make it so you can figure out how to just do it purely off of that one adjustment?
No, I'm not trying to make an adjustment, do the work of doing all that other soft tissue
Okay.
stuff. Um, I am offering the adjustment, and if that gives you relief by itself, fantastic.
Yeah.
But if you need those other things, I'm going to refer you to those people, and there's a ton of value in that. Uh, so I'm not saying one chiropractor has to do all those things, and he's a better or not better chiropractor.
Yeah.
Uh, Obviously, if you do offer all those things in one visit, fantastic. But um, just as long as the patient has access to those things, they're going to get better with them.
Yeah.
Mm. Do you plan on like actually making your network inside of your facility have those options available for people? Like I know you mentioned kind of business sense, like your time is valuable. There's only so much, you need to see enough people to probably make sense of it from a business perspective. But like, how do you view that from like your own personal business? Like, where are you trying to grow to?
Yeah, so the beauty of the practice that I have here is I am affiliated with a group called Bioperformance Institute. And within the same space, so I have an office within an existing space, and they have physical therapy, they have sauna, they have a cryo chamber, they've
Mm,
got IVs and injections. So if someone comes to me and I say, hey, your shoulder issue needs some rehab as well, like go right over there. They're going to help you out.
got
Yeah.
it. You're in a similar situation as you were in Cali then.
Yeah, and that's what I was looking for.
Oh,
Yeah.
okay. Got it. I thought you were like, oh no, like I'm going, like this is like my own freestanding building. Like, like that's what I was envisioning. But now it makes a little more sense where it's like you can truly just be a master of your craft because everything is still, you sought that out, which is cool.
Yeah. Okay, I'm gonna go far. I'm gonna go far left here, Dr. Yazdani, just because, like I said, I'm a crack addict, and like I feel like I've fallen prey to all these like YouTube videos that are just like crack adjustments called like ASMR crack adjustments, which I don't recommend anyone watching those. But um, can someone be like overly like crack? Like I feel like some chiros. I've talked to this chiro once before where he said, I learned from someone a long time ago, like he'll crack this guy and he's just like, yeah, keep coming back every week. And it's just like, and I was like, how is that a good form of treatment? It's just like a you're just getting this guy on recurring cracking. Like, can someone be over cracking? Can people just be like cracking themselves, like without a chiro, like cracking themselves? Like, yeah, I crack my neck sometimes, like into like unhealthy like bone joint issues or something like that.
Okay, so that's three questions. That's
Sorry, sorry.
so one, can you be over adjusted? Two, how often should you be adjusted?
Yeah.
And three, can you self adjust? So I'll start with, can you be over adjusted? And the answer is yes. Typically, you don't want to be adjusted more than three times in a given week, because as you adjust the same area over and over again, you're creating mobility through there and stretching the, like, let's say these are two bones that come together. There is a capsule that goes over that. Think of, are you guys familiar with cars?
Mhm.
Yeah, controlled articular rotations. Yeah,
So,
Dr. Espina. Yeah.
so do you know what a CV axle is?
What was that?
CV axle. So like it's two pieces connect and there's a rubber boot that goes over it. So
Mm.
if you stretch these ligaments out too much without strengthening the musculature that surrounds the joint, it will cause instability of that ligament. So I'll go back to the shoulder. Almost, let's say you adjust the shoulder so much without strengthening the muscles that surround the shoulder, you may have more predisposition to this shoulder dislocating because
Mm.
you have created so much instability within that joint. And so another another way that this happens too, and let's say people who self adjust, is when you self adjust and you're doing the same spot over and over again in your spine, it's like a chain. Each vertebra stacks on top of each other. And imagine if you had a chain and you just keep wiggling one link within that chain. That link is going to feel loose compared to the other ones above and below it. And then it's always going to feel like something is off there. So we don't recommend people to self adjust because you're not getting a thorough uh, alignment or movement of that chain.
Okay, got it. I've got to stop cracking my neck and probably create some stability. So I grew up wrestling and I injured my neck all the way into college and did a lot of jiu-jitsu. And I was listening to this, like, if I'm constantly cracking, it's probably because I need to create like stability, huh?
Yeah.
Yeah. I gotta
And
get
one
some,
thing,
gotta get the iron neck and just start like creating that that
yep,
stability.
yep. One thing that's super underrated and people don't know and neglect is neck training. I'm in the gym and I put a 45-pound plate. I've worked up to this, but I put a 45-pound plate on my forehead and I do neck curls like this. And
Yeah,
then I do a 15-second hold. And let me tell you, it's made my neck so much stronger and even thicker, and it makes your physique more proportionate as well. Like you
yeah.
can be the most jacked guy and you have a little skinny pencil neck, and it's going to throw everything off.
Well, it's also just for the physique, but also like sports performance. Like
Yep.
did that with a lot of my wrestlers. You know, work with like lacrosse players, and I put it into their training. I even put it in training for people that are not sports performance world. I just do it for my old clients and stuff. I get the band and I just make them do isometric, like maybe just some lateral rotations and stuff like this. And they've noticed they feel more stable and they're not, feeling off. But I know for a fact that they've studied the neck and that um, training the neck, especially for the high speed sports, just been helpful for like concussive, mitigation as much as possible.
Definitely. Were you doing wrestler bridges when you were doing
Yes,
wrestling?
so I don't know if those are the best idea. I've heard different things like wrestling bridges because like I hear it's like compressive and
Yep.
it's like awkward. So yeah, what's the take on that?
Yeah, so the cervical spine is not meant for a lot of compression. Those discs are very thin, and so I don't recommend doing wrestler bridges. But other ways you can train your neck are with a head harness. Gently, you can a harness that goes over your head and it has a chain. You can do extensions, and then you can lay off your bed, do chin tucks, and then progress that with weight
Yeah.
or doing holds. The iron neck is also great. But the holy grail of all neck training equipment is called a four-way neck machine.
Yeah.
I have only ever seen one, and it was at a kind of like a physical therapy style training office. And it you can do flexion, extension, and lateral bending. And let me tell you, it's the best for your
Yeah.
neck.
Yeah,
Hmm.
I like that one. I like the iron neck. I like just the bands too. Just putting a band around, just like rotating and just holding it.
Yeah.
Doing like different movements. That's a little bit more high level, but I definitely think a lot of the neck training could be, like you said, great for the physique and great for stability and great for performance. So I definitely recommend that for sure. Yeah.
Yeah.
Hmm. You know, my gears turning about what I want to ask you next here. So, you speak three languages. Which one was the hardest to learn, or was that all just mixed together in your household?
Well, two of them were mixed together, English and Farsi. The third one I learned in high school, which was Spanish, and I just try to practice it as much as I can with my Spanish speaking patients or traveling to Spanish speaking countries. Uh, but hardest, I, I can't really say a hardest one. It's just whichever one you use the
The
least frequent
least.
becomes the most difficult.
It's funny because hearing my doctor, talk to his mom or dad in Farsi at times is it sounds so angry, but it was like an "I love you." It was like actually just like a heated, passionate like moment, and it's like, what were you saying?" He's like, "Oh, it was all good stuff." I was like, "It didn't sound good," but I think it's the inflection and tone that is more common in that language than English, for example.
Yeah, Farsi is actually a very beautiful poetic language. So, for example, like when you tell someone you miss them in Farsi, the translation is "My heart grows tight for you." Like,
It's very poetic. I love
Well,
that.
lost in translation for sure. Like, I mean, I feel like some of the isms in Spanish, well, Spanish to Portuguese, like there's certain things you say in Spanish, but you go to Portuguese and it's like immediately like an FU versus like a term of endearment, which is hysterical to me for like pretty sister related languages and things like that. But
Well, that's the same thing in like Tagalog. So I grew up in the Philippines, Dr. Yazdani, and like cake in Tagalog is like puto, but in Spanish that's not so nice.
yeah,
yeah,
So yeah,
yeah, you
yeah,
guys are cool. You got different languages you can tap into. I'm over here just like English and picking up bits of pieces of my heritage's broken Spanish or my personal broken Spanish, but trying to hear my grandma and then my aunts talk, trash because they'll move to Spanish as if we can't pick it up. I'm like, no, I know what you're saying. I just can't communicate with you.
you just got to go to one of those Spanish, whatever country it is, stay for a month, and your grasp on the language will get a lot better. That was probably the biggest thing for me learning Farsi was just going every summer and spending like a month in Iran.
Yeah,
You have no choice but to speak it.
yeah,
yeah.
yeah.
They're like, hey, no, you're gonna learn. You're gonna learn today how to actually communicate. And yeah, Seamus, Dr. Mortari goes like, yeah, you need to get out of the country, bro. And I'm like, I know, but you got to convince my wife. I'm game. I'm down to just go take 3 months and go to Italy and learn Italian or something. Like, sign me
Yeah,
up. But
I agree. I every time my one of my best friends growing up, his name was Amir, and his older brother's name was like Amin, and he would go to Iran like once a summer, and I'd go to the Philippines or I'd go somewhere else. And every time he went to Iran, I was like, dude, I need to come with you. Like it sounds like every trip you have, like the food sounds amazing, the adventure sounds amazing. Like what was going on? I was like, well, we could never made it happen. But I definitely think, Marcos, where have you been
I
outside of
haven't
this country? You haven't been out of the country?
been to Mexico, bro. That's in Puerto Rico, and then some of the islands in the Caribbean, if you really want to call that like international travel. But
That counts.
ish, you know what I mean? You're in a resort or you're coming off of the boat and you're just doing zip lining through the jungle of wherever it was at the time. And yeah, good experience when I'm a kid, but like no actual like culture like being assimilated into and like understanding it deeper. I have a
Yeah.
deeper appreciation for as I've grown older. And I think it's always like cool to see people that have, because I mean, how old are you?
30.
30. All right. So we're all same age here, right? Like just the different culture and upbringing can be so different amongst all of us, even though we were all, I mean, were you born in Cali?
I was born in Ohio, but raised in Cali,
Oh, okay. What part of Ohio?
Columbus.
No shit.
Oh
Okay.
yeah.
Yeah,
Okay. For you were
but
there for a brief stint then?
yeah, only as a toddler.
Okay. It's funny because I've actually done a great deal of travel over the last couple of years to Columbus when we had a center there, and then my cousin actually recently moved there, and my family is from Ohio originally. I feel like everybody, all traces point back to Ohio for whatever reason for people.
Yeah,
Tracing the origin of man. Well, your
yeah.
parents thought Ohio would be a good place to get to start.
Were your parents immigrants, Actor Yazdani? Did they come from Iran and then they found themselves in Ohio, or how did that go?
Yeah, so they were both first generation immigrants from Iran. Um, they met in Missouri because that's where they landed and went to school with their visa.
Mm,
Uh, I'm not sure why they ended up in Ohio, but after a couple of years of being there, they just decided, we're done with the cold and the snow here and only, little diversity. And they moved to California.
yeah.
And
Good call. There's a lot more diversity here. Probably a little bit more inclusive of Persian folks.
Yeah.
definitely. And then here I am going the other way back to Idaho.
The land of the potato. The land.
Yeah,
Hey, at least that's good for the bulk. That's good for the bulk.
it's good for the bulk, man.
Yeah.
Uh, but what's funny is when you go to where there's diversity in America, it usually falls on the coastal states. So, like
Mhm.
Washington, California, Florida, a lot of the East Coast, New York, Virginia, and so on and so forth. But now those places have gotten so expensive that the second generation of immigrants are now kind of branching into the interior states. So you're going to see more diversity in those states, probably
That's
in
pretty
this
cool.
generation, generations to follow.
That's pretty
Yeah.
cool.
The diversity definitely is ticked up as you kind of move away from the coastal cities, at least from my perspective, travel, but also just pockets. Ironically, like one of our patients came in the other day and she ended up being a Puerto Rican from New York. And I was like, oh, what are the odds? Like again, so my heritage is actually Puerto Rican and Italian. So I was like, New York, Puerto Rican. Yep, that sounds about right. Like any other Spaniard that's there would be out of place in my head. But I think in future generations, it would be like you wouldn't expect anything. You would expect there to maybe be a bit more diversity there. But
Yeah.
the so you mentioned bulking, cutting, journey with like fitness. Like what I mean, like you said, I can't size you up because I'm only seeing your upper half here, but like
Hey, you can't tell from his neck, bro? Like,
Yeah.
come on, dog.
I mean, he just told me he trains his neck exclusively, Seamus. So I mean, he could be throwing me off big time. Uh, but yeah, I mean, like, so how does a chiropractor train? Like, do you have more joint safe movements you like to include? Are you just kind of like the sling whatever whenever it gives you that? You're like a lengthened muscle kind of guy. Like, what's your cup of tea here when it comes to training?
Yeah. So when it comes to training, lifting weights has always just been the base that supports all the other activities I do.
Okay.
So it's always been bodybuilding style training with, having like push pull legs or, trust and try, back and by, whatever. And it's more for just general health and aesthetics. Uh, but it does help you with other sports like contact sports, just being able to use your body against other people. So I played a lot of basketball growing up, And these days I do a lot more solo sports, so like mountain biking and paddleboarding. Uh, but that's been my experience. And yeah, bulking and cutting, the nutrition side of things is super important too. I mean, that's the fuel for your body. Um, and so I I find that when I try to give advice on this to patients, it's just it's it's like dragging, you know, a cat into a bathtub. Like it just people don't want to do it, and
Well, let's not give advice. How about what do you do? What are you doing with your nutrition to support your aesthetic goals, performance goals at the moment?
sure. So I lift weights about 5 to 6 days a week, and then on my off days I do active recovery. So that can be like hiking or biking. Um, I'm like I said, doing basically a upper, lower, or push pull legs. So like today I went in and I hit some chest and uh, like I hate to say it, but like your typical gym bro, get in there. And most chiropractors, I mean, they come from that kind of a background of some kind of sport or uh, athletics. So
Yeah.
to me, it doesn't really matter what you do as long as you're moving your body one way or the other.
Yeah, yeah. No, I hear you. Yeah,
Simpleton. He's a push pull legs, push pull legs kind of guy. It sounds like you're like I'm gonna hit a hinge version on one day. I'm gonna squat on another. I'm gonna hit an incline and a decline or an incline and a flat bench. It's okay. I mean, bro
I
splits,
like
they're
bro
effective,
splits,
man.
man. I love that.
Yeah, I'm keeping the mechanics in mind too when I'm doing exercises. So like I'll make sure not to do anything that puts too much internal rotation of the shoulder and causes impingement.
Yeah,
Um, like even when I do tricep pushdowns, instead of doing them like this pronated,
yeah,
this crosses the ulna and the radius and puts a lot more strain on the tendons and ligaments that cross the elbow.
Mhm.
yeah.
Do a lot of that supinated.
Ooh, okay.
Uh,
Yeah, what are those little tricks? Keep going, keep going. I'm writing notes. I'm writing notes.
Um, for deadlifts, I'm a taller guy, so doing a straight bar deadlift is kind of a higher risk for my lower back
Yeah.
and causes injuries. So I will do those with a trap bar or hex bar.
Do you do it elevated?
I don't do it elevated, but the handles on itself are elevated. So if you're comparing it to the deadlift, it's definitely going to be a little bit easier, but that's because it's also biomechanically more advantageous for you.
Yeah,
Yeah.
yeah. I agree. I agree. All my tall guys that I work with, I'm just like trap bar, easy. Like it's just easy. It's easy to put them in there, and I feel like it's a technical thing too. Like they get it. Like I've had people where I've had to coach them into a deadlift, and I'm like spending hours just trying to figure out how to get them into a deadlift, and then I put them in a trap bar. I don't say anything, and they do it themselves perfectly. I'm like, okay, like I'm gonna save myself a lot of time here and a headache. Don't have to coach it too much, and I don't have to say anything. So yeah, I think the trap bar is it's a really safe movement overall.
I mean, if you've been carrying your groceries, you're doing the trap bar deadlift. Like, so,
Carry
think,
over.
yeah. I mean, think about it. Would you lift your groceries out in front of you? Just think about how much of a risk that puts on your lower back, and
Yeah.
it's
Okay.
just more popular because the manufacture of a straight bar is so much easier than a trap bar.
No,
Otherwise, you
100%. I think this would be a good segue then into okay, the training splits you're doing are like the basic movement patterns like push, pull, hinge, squat, lunge, core, neck work, some specialty stuff, especially with the neck. I think if there's anything that anyone takes away from today, no matter what age you are, if you do a sport, you probably train your neck just a little bit, right?
sure.
And you could add that in. I definitely agree. I think creating stability. Um, Marcos and I have obviously been in the fitness world. You've been in the fitness world. What are your thoughts on these like extreme ranges of training type of movements that you might have seen, like new people coming out on Instagram, social media? I don't know if you have time to always look at that, but people doing like really hard movements in different ways. So one of the things that first came to mind was like, okay, you're doing deadlifts. The extreme version of that is like a Jefferson curl. Do you know that one, the Jefferson curl? Do you know that movement?
I don't.
Okay.
Think of it like a rounded back deadlift, but intentional.
Is it the one where you put it on your forearms like this?
That's a Zercher
You could
one.
do a
Yeah.
Zercher variation of it, but just you could do it as purely as a overhand grip as well.
Yeah. So think like dolphin back, like you're literally curving your spine under load on
Mhm.
purpose, and you're like separating each vertebrae slowly and then
Sure.
coming back. Yeah. So maybe that might have been the wrong example because
No, I think it's a
that's
good
like,
example.
I get what you're saying, though. Yeah.
yeah.
Uh, well, whatever exercise, whatever movement, whatever anything you're doing throughout your daily life, you want to put your body in mechanically the most advantageous position to bear that weight. So when you're doing, let's say, hinge movements with a lot of flexion, you're doing your spine at disadvantage because each segment of your spine has 2 points of contact. So I don't know if you guys know what a vertebral segment looks like, but essentially there's a circular a circular space where you have the disc, and then it contacts with the next segment, and then you also have where the spinous process overlap as well. And so in a normal segment, the disc bears 75% of that load, and the bone on bone, where the spinous, I wish I had a spine model to show you guys, but bears the other 25%. So when you're doing something in uh, such high degree of flexion, those spinous processes are not approximating, and you're taking 25% of your structural stability that's built into your spine out of the equation, and now you're putting it all in that disc, and
Mm.
discs can rupture. So uh, what I would say is those are definitely risky movements. You can maybe build up to them and uh, strengthen the muscles that surround your spine, but you're, without a doubt, you're putting yourself at risk of injury, and I wouldn't recommend it.
Okay. That makes sense. Yeah, because
Yeah.
Marcus and I have had some guests, and they talk about these things. These are definitely
It's
these
an
are more.
interesting hat because it's not like he's saying you need to do these movements, but it's just like, the style of training that he liked to emulate was it the Bronze Era
It's
or
like the old school,
old
yeah, old school
school
lifts, like
left
kind of like
pair?
when you see the circus from like years and years ago.
Yeah, and it took him years to build up, like he said, to do what it looks like a fucking circus trick. It's like a Zercher deadlift, Jefferson curl with like 405 pounds, and you're just like, how in the hell does this even? Again, like you look at it, you're like, there's no way. There's like, come on,
I'm gonna break
like,
my back.
yeah.
Yeah.
Mind you, this guy also like can deadlift with one hand more than Seamus and I combined, kind of thing. It's like stupid, like feats of strength. But
Yeah.
again, like I think part of us always wonders because there's obviously the conventional wisdom or again knowing how biomechanics works, and then yet there's these people that start training these kind of extreme ranges of motion, say that they got out of pain as a result of utilizing this like odd strengthening thing. So it's uh, again, I think Seamus is curious because it's like, is the is the juice worth the squeeze? And that 25% integrity is a pretty significant reduction.
Yeah, it's not worth it to me.
What
you,
was
can,
his?
you can do
Yeah,
whatever you want to
if you have
Yeah.
a moment, you can go look at Atlas Power Shrugged. Is that what it is?
Yeah, Atlas Power Shrugged. You'd be surprised. I mean, I like what you did say there, Dr. Yazdani. Is like, hey, you did say expose yourself to the movement that is there, and if you can gradually work your way up, awesome. If you're not putting yourself in danger, great. I think there is the space in training for some folks talk about this full range of motion training or like extreme ranges under load. I don't think everyone is built for it. Like some other people, like knees over toes guy, and like they're doing like other stuff. But I think his stuff was more extreme in the beginning. Now it's more gentler and more consistent with a gentler message and just telling people, hey, if you can access a certain range of motion, if you can do some lateral flexion, um, in conventional wisdom, these are some of the movements that you would avoid, um, because they might put you in a compromised position. But if you can put it in yourself in your training, slowly bring yourself there, and helps with you getting out of pain, okay, like it's totally fine. I don't think you need to go to these extremes like Marco was just talking about with this one example of like doing a 400-pound Zurcher Jefferson curl. But I think if you're doing something that allows you to get out of pain, I'm completely cool with it as well.
Yeah, I'm looking at his page right now. He's done some crazy stuff.
Yeah, there's one of
Like
the
a
video.
400-pound, one arm Zercher. Jesus Christ.
I know. And you just look at that, you're just like, again, he's like, he built that up, and he literally did most of his like training
In a parking
at
lot.
the start of COVID. He's like, I like moved to this style of training of like parking lot bodybuilding, and we're just like, well, yeah, now you're 5 years into it, and you've developed some nutty strength in awkward ass positions. And I mean, the human body is pretty amazing, and I bet you if you looked at his X-ray, he probably has something bulging, but it's just asymptomatic. You know what I mean? Like, there's probably no doubt in my mind that that'd be the case.
Yeah. When I think of this scenario, it's like everything has its tolerances. So, one hobby I'm into too is off road driving. And one thing you never do with off road driving is turn your wheel all the way and then floor it because you'll snap one of your front drive shafts. And you can go slowly and maybe do like a lighter load through that equipment. Uh, but when you put a crazy load through it, just because you can do it at a lighter load doesn't mean that it's going to support it, with so much more. So,
Yeah, yeah,
That's again,
yeah. It's a
it's
it's a it's a give and take. It's a threshold. I mean, the guy, built his whole business and look with that. Um, it's a double-edged sword, social media, right, Dr. Yazdani? Because it's like, all right, this guy's doing things. He might inspire some people to do some things, but then they might they might get hurt, and now they got to go see you.
yeah.
I think
Yeah. I got a question for you guys. What maybe misconceptions have you guys ever heard about chiropractic?
Um,
mm,
well,
misconceptions.
I'll tell you this: there was not a misconception, but like something that was like so dumb. And even I've talked to like my chiropractor friend about this. There was this. You may have seen this, Doctor Yazdani, because it's in your field, but it was like 3 or 5 years ago. There was a flight, and a guy was having a heart attack, and the chiropractor was like, "No, I gotta adjust him. It's gonna bring his heart rate down." Um, I don't know. Did you hear about this thing?
I didn't hear about it, but go on.
So basically, there's like a bunch of doctors on this flight. Not all of them are like emergency room certified or anything like that. But like, I don't know what they did exactly, but they had the guy lay down. And one of the guys was a chiro, and he's like, no, if I can adjust him, it'll bring his heart rate down, everything. And you've got to look into it. But it was just such a weird, such a weird thing. Like, and I was talking to my chiro friend about this, and he was saying like, yeah, some chiropractors get in their head that they're going to solve every problem. Like a lot of ailments can be solved from chiropractic. Maybe that's like a misconception that is seen.
Sure. Yeah. So I don't know about bringing down his heart attack, but um, I guess one thing that chiropractic, the misconception, or maybe how these far-fetched claims came around, were a lot of the older chiros, they used to overpromise and underdeliver. And so everything that's in your body is connected to by a nerve, and that comes out from your spinal cord, and it comes out from in between each one of your 24 segments. And so some go to your heart, some go to your kidneys, some go to your spleen. Um, the more common ones that you think of are the ones that go to your muscles, like your arms or your legs, that can cause sciatica or more um radicular symptoms. And so uh, when there's impingement on those nerves, it interferes with the function of that muscle per se. But they took that and they applied it. Well, if it applies to the muscle, why can't it apply to the organ as well? And so if someone's having, a kidney problem or a heart attack, they say, okay, well, the T4 nerve goes to the heart. Let me adjust the space where it comes out in between T4 and T5, and it's going to help them with their heart problem. But that's a flawed thinking, because it's like, imagine you have a computer and you have all the wires that go to the hard drive or the CPU, and instead of fixing the CPU, you switch the wire that goes to the CPU. You know, you're not fixing the right thing.
Yeah.
And so I think that's where that comes from.
Okay, got it. Yeah, that makes sense. Like I've heard of certain chiropractic. I mean, probably this is like an older version of it, and like maybe like the old guard of chiropractics, where they're like, yeah, they're promising, oh, I'm going to help you with like a bowel thing, or I'm going to help you with a another thing other than a musculoskeletal thing. They're talking about like skin or like I don't know, some other stuff that is more organ level, and it's just like, yeah, that doesn't make sense. It wouldn't make sense to adjust someone to get them out of a heart attack.
Right.
I mean, are there any links though to like, in your anecdotal experience? Like, cause that might be a conception I've had as well. Like, can an adjustment like on, let's just say like a baby that's dealing with like gas issues help with their gas? Have you done anything like that or heard of anything like that?
Um, I have heard of things, and women who they've taken their baby to a chiropractor and helped with them. But I can't say that it was enough to be causation. It's more of just an adverse effect, a positive adverse effect of the treatment
Mm.
that just happened to help someone with something like maybe their digestion or their uh, blood pressure, their headaches. And on the topic of blood pressure, one experiment I've been wanting to do is take people's blood pressure, adjust them, and then see if it changes. Uh, or take their height and then adjust them, see if they get taller.
I'm,
Done
I'm
that
down for
study?
that. I'm down for that.
And just debunk these things, see if there's any validation to them. So,
Yeah, yeah.
but
Yeah.
I can't say no. Like I've never personally done something that people might say, oh, it helped me sleep better, but it's hard to narrow down the pathway of why.
Yeah.
So you mean you never adjusted somebody that's been full of it and they finally like, oh my God, I finally had a BM after you adjusted my sacrum. No.
Yeah,
Got it. Okay.
not those kind of miracles.
Uh,
I kind of like want to go turtle mode. I want to get like fully like stretched out from the spine one day.
Yeah,
I feel like
yeah.
is that the activator? I see you had that listed there. Is that the one that like does the little like tilt at the midpoint kind of? Is that which machine is that like on the adjustment table?
Oh, that's called the Leander table, or flexion distraction, where it bends at the
Yeah.
waist. Yeah.
That
Uh,
one. That one. Oh man, when I was dealing with my back issues, that one's money. I could sleep on that. Just
Yeah.
slowly
That
soothe me.
that one is good. Anything that really decompresses your spine feels good. That's why, Seamus, your neck feels so good when people pull on your head, or whoever it was.
they like separate my head. I don't know why, it just feels good. I
Yeah.
don't know if I have like a pinched nerve or anything like that. Maybe I do.
Probably.
And that like it helps a little bit. When you were talking about that table, you know what that reminded me of? Like that flexion of the hip,
Yep.
the reverse hyper, Dr. Yazdani. Have you heard of this? The
Yep.
reverse hyper? Do you
Yep.
recommend that as like as a form of training with patients, or as homework or something like that?
Yeah, it's a great way to strengthen your lower back.
Yeah, I
Yeah.
love that one a lot. Traction, get some strength in there as well. It's one of my favorites.
Yeah, traction is awesome. Anything that decompresses your spine feels really good, because gravity is compressing your spine 24/7. So you're just opening everything up.
Yeah, and
Yeah.
also with that said, then like hanging, like just hanging, like that's a positive for most folks, right? For like shoulder issues and stuff like that. Like just
Yep.
okay, good. Yeah.
What about being hung upside down like a piece of meat with some inversion boots or an inversion table? What are your
That might
what are your
be
takes on that?
something else, huh?
The inversion table, it's so difficult to use that most people, when you're having a back injury, cannot have the wherewithal to get in that and not make it worse. And and even if like when you're hanging straight upside down, you're in a lot of extension, and it still feels like your back is getting compressed unless you actively engage your abs and so that your spine is more neutral and can be
Mhm.
distracted open that way.
Oh, okay, that makes
Yeah.
sense.
Yeah, I always felt like I got the best like inversion table stretch with like hard activation of glute and core, like front
Yep.
and abs. Like I would get that like tight squeeze and then like slowly let it kind of relax, and it would lead to like a better decompression overall. But like no one ever told me that. But I mean, it kind of makes sense based on exactly what you just said. Like kind of lined you up a little bit better to actually get that opening.
Yeah, the best treatment for decompression is called a spinal decompression table, and it's you're strapped in and it pulls you from your pelvis and decompresses your lumbar spine, and you can also use it for your neck as well.
Yeah,
I
yeah.
need
Yeah.
that. Uh,
Gonna need a lot of that.
yeah.
I'm doing a lot of running, Dr. Zani, and I feel like that's so compressive, like I feel like just from just the up and down, just
Yeah, I mean, every when you're running, every step that you're taking is jarring your entire skeleton. So um, that's why everything kind of feels tense afterwards.
yeah,
Oh yeah.
Yeah.
100%.
Yeah, we both did high rocks this last weekend, and my hips and body are like, I don't feel bad, but I'm like, I'm definitely a little more sore than I gave 8K of running credit for.
Uh, I've been seeing high rocks. Just some of my patients and friends who are doing it. Is it a like a CrossFit type of workout or?
It's more of like a fitness race. So it's the same thing every time, whereas CrossFit is constantly varied, right? So you don't always go do the same event in CrossFit. Um, but with this one, it is. And there's 8,000 meters of running, but between every 1,000 meters, you're doing a station. And honestly, from an event perspective, like the flow and the fact that it's just kind of going on all day, they're just running like they're sending out a heat every 10 minutes, like for in perpetuity for 2 days. And so you just get in there and there's just an environment of people like running laps and then doing stations. And you're like, this is kind of cool. Like, and
And
being
they
a part
never
of
have a
it.
station that's filled because they've done the math so well that like you're always getting to a spot and it's free.
Yeah. It's,
Hmm.
yeah. Yeah. I mean, what do they have? I think they had like 60 rowers and skiers and then 60 sleds that basically like, again, you don't run into that issue if you have a heat of 60 people going off at once. But it is from a perspective of training and like taking market share over CrossFit in a sense, like it's definitely done so because it's like you can sign up for this thing and you could be completely out of shape. There was people doing it that had no business doing it this weekend, and they're out there just grinding through it. I'm just like, dude, like this was like I trained for this and I still felt some type of way. And these people were like obviously very, very undertrained. One of Seamus, you missed it on Sunday. There is a dude that like I don't know if he like legit tore something or if he was just cramped up, but he was like over needed a medic, like dying over there. He's just like like straight up in the cab, and I was like, oh, poor bastard.
Yeah, it is a lot of running. I think the difference there, I know that like um, CrossFit had a lot of like injuries, right, from all the movements and stuff like that, because it's just you're getting a lot of like overhead stuff and then doing this. The difference between this one, Dr. Zani, is that the movements are like lower skill or like approachable skill because it's just like skier, rower, sled. So it's nothing anything overhead. You're pushing a sled, and pulling it. Lunges, burpees, and then wall balls, squat to press, like with a light weight. So nothing like Olympic lifting, nothing like powerlifting kind of stuff. 50% of it is running. So that's probably where most of those injuries are coming from, like a heel thing or like a calf thing.
Gotcha. And is there like there's no high rocks gym where people are training these movements? It's just there's this
Ish.
challenge or
So they have affiliates, kind of like CrossFit affiliates now. They don't have like a specific High Rocks gym except for the one in Germany that they're creating, like or London, a performance center. But a CrossFit gym has all the facilities that is needed for High Rocks, and that way, a lot of CrossFit gyms are becoming High Rocks affiliated, And as a business model, it just makes sense. So people are like jumping in, and it's pretty easy. So like if you wanted to jump into it, you're technically like could just jump in right away, because now you just have to add running into your program and then some of these functional movements.
I see.
Yeah, it was a good time. I mean, if you're, I don't know, what like the closest one for you that comes up in this season, what was it? Chicago is the other one. Like they have
Chicago.
Chicago, New York, I think Houston and Miami Beach for like the foreseeable future, like of 2025. They'll probably add more. I'm surprised there's not more because of like the turnout that they just had here in Vegas was pretty nutty. Like I'm like, okay, like this is better than I expected in terms of turnout, but also at the same time, I'm like, there are things that they could definitely do a little bit better in terms of like food. Like there was nowhere to buy any food, even though we're at like the convention center. So just like, I mean, from an experience standpoint, things for people to train with. And again, like from a safety profile, I think I like it a little bit better. Those who get into training to do high rocks will probably end up doing something similar to a CrossFit-esque type of gym or boot camp stuff. But again, people that do exceptionally well are generally some CrossFitters that are a little more specified in like the running. Because I know one of the games athlete did it with like the best high rocks guy that won the Elite 15 the night before, like the first night. And these guys did it together in like 56 minutes. I was like, I didn't know that he could run like that. So it's pretty nutty. And anything sub 1 hour is like, if you go give it a shot, you'd be like, holy hell, how are they moving at that pace?
Yeah, it's pretty cool. It's pretty cool.
Sounds like an ass kicker.
Yeah, it is. I think it's kind of like a 5K, 10K, half like a marathon. It kind of falls into that category of like a fitness race. It's consistent. It's adding a few things. I definitely believe it stands above like a Spartan or these other things or mud runs, because just from a safety profile, it's indoors. The movements are great, and the experience just feels great. Plus, like with this outdoor stuff, there's just so many different variables. Could roll like an ankle, run into people. I don't know. It's just
I don't know.
High Rocks is like
I would say that outdoor stuff has its draw though. I would do one of these outside, but I know the standardization of like surfaces matter. And
yeah.
the thing that like, again, the thing that kind of sucks is that it is the same thing every time. So it's like, I like the novelty of CrossFit where there's variance. So if they throw in like different movements over the years, or they have like a different variation, yeah, sign me up. But I don't know how many times you'll catch me doing this particular thing. If it
Once a
shows up,
year. Once a year.
if it shows up once a year, yeah, maybe. If they like have a repeat in Vegas, I'll be like, yeah, you know what? This year I'm gonna go do the pro stuff and just suffer through it like, with all my buddies that are cramped up. So,
Yeah.
Yeah.
um,
But
yeah,
Dr. Yazdani, we've had you for an hour. We appreciate the time. I appreciate you giving the story on your life, chiropractic, and all that. With that said, where can people find you if they wanted to get some hands-on help from you, if they're dealing with something they needed? How can they reach out to you? And anything else you're excited for in the upcoming future before we go?
Yeah. So if they want to see me personally for treatment, I'm opening March 1st in Coeur d'Alene, Idaho. And the best place to find me is on Instagram, Dr. spelled all the way out, Dr. Yazdani DC. And yeah, excited to get going here in Idaho and see where the future takes me here.
Awesome.
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 I
All
do
right.
have some patients in Idaho. I think they may be in your neck of the woods. So if they ever need any chiropractic stuff, I will be sure to give you a little referral and look at their distance relative to your clinic. So I'll make sure to get that information for myself. So
Sure. I'm in North Idaho, so way up almost to the Canadian border.
Oh, wow.
dun dun
Yeah.
dun. Yeah. Well, I mean, they're all over. You never know. It's I feel like the when I looked at your address, I'm like, why does that sound familiar? And it's probably because I've seen it on a patient account. So just saying.
Okay. Right on.
But yeah, I mean, again, thank you again for giving us some time and some insight into chiro and chiropractic and kind of like where you stand on it, why you were drawn to it, and maybe more people that listen to this will kind of also consider that as a potential career path if they're kind of early in their schooling. Different way of getting a hands-on treatment and a way of medicine that can help people look and feel better in a sense. And as health practitioners ourselves, we love that so many people have a very common mission of like going after this new age of medicine, this medicine 3.0, where we're getting down to like root causes and issues so people can feel better by actually fixing shit versus just medicating it. So macro perspective, you guys know what to do. Give us a like, give us a follow, comment below. If there's any additional questions, go up and hit up Dr. Yazdani in his personal feed. That way he can answer the questions you might have for him. And until next time.